Do you want to know more about modern professions, but are afraid of asking a silly question? We will ask all the questions to the professionals for you, and they will tell you how everything really is.
You might think it's an odd question, but these type of questions are very common in pharmacy. Interaction is a big topic in pharmacy. There are a lot of food dispensing fee. So dispensing fee is a fee. My name is Asad Gavahi. I am a pharmacist working in Lloydminster for the last 6 years. Education of the patients, it's a very important topic that we as pharmacists and almost every other healthcare professional is focusing a lot on it these days, because we cannot use a certain method for teaching and training people. People have different backgrounds, different level of education, even different age range. You need a different approach in order for your education to be more helpful. They have to understand the need of it. They have to understand the necessity of that therapy or that change in the lifestyle in order to implement it. And different drives and motives can actually help the people and the patients to be more successful in those decision-making moments. It's almost impossible to remember all medications, and also it's mostly based on the type of practice that you have as a pharmacist. Like any other healthcare professional, if for instance the person is cardiologist, they won't have so much knowledge of cancer medications, right? Not that they don't know, but they can go and read about it and refresh. For us, the same. If we're practicing in community, so we know a lot about the medication that we use on a regular basis. But if I'm not, for instance, dealing with cancer medication, I don't have, or some antiviral like AIDS or hepatitis C medications, stuff like that, I have to go back and look at the books or whatever and refresh, which we always do on a daily basis. It all depends on the jurisdiction that you are practicing in. So College of Pharmacists is the body who determines if the scope of practice for the pharmacists in each province. Alberta College of Pharmacists have started a program called Additional Prescribing Authority for Pharmacists. So pharmacists with certain years of experience, they can apply for that designation. They have to go through some training, some materials, some cases they have to submit, and there are judges. There are 3 different assessors who check those, and if you pass, you can get that designation, so you can prescribe for certain indications. The pharmacy, if you look at the business side of the pharmacy, like any other business, you are facing challenges that every other business faces. Not even looking at the pandemic, so growing more competition, so it's just you're losing more market share, so your sales go down, you have staff that you need to pay, you have a rent to pay, a lot of bills to pay, you buy all of those medications or the front store medications that you're using, and you have to pay back. So you have to have in order to have some money to come in order to be able to pay for that. And it has become tougher and tougher every year. In terms of practice, knowledge is changing and evolving on a daily basis. And for us, in order to be on top of the game, we have to study, we have to have enough time to read the new materials, new guidelines, and with that we can help our other healthcare professionals in their decision making and also our patients. Can you look at this rash? It's actually, you might think it's an odd question, but these type of questions are very common in pharmacy. Not necessarily this question, but some stuff like this, we pharmacists, we encounter on a daily basis, because the pharmacists are that one in the healthcare circle that are most readily available to talk to. So gladly, we are a very trusted profession, so people trust to what we tell them. So they call, they come, and yes, they ask about the rash, they ask about a lot of other things. And there are times that they show it to you, there are times that they do some other stuff too. So it is what it is. So if you are, and if you're comfortable, if we know about it, yes, we do recommend. And as I mentioned earlier, for some of us that are prescriber pharmacists, we actually can prescribe prescription needed medication for those indications as well. So right now, our focus on seniors are their annual influenza vaccine, which is flu shots. Also, pneumonia vaccine we do recommend for people over 65 if they don't have any concurrent medical conditions. If they have or a higher risk, we even recommend it at earlier ages. Those are the two important ones, which actually the government, both of the government of Alberta, covers the cost of it. Government of Saskatchewan only covers the cost for the influenza vaccine. We do recommend shingles vaccine for people over 50 and 65 because they are more at risk of getting shingles, and it's a painful infection. There are other vaccines available that it's based on the criteria that they can meet, but these are the most important ones. Yes, interaction is a big topic in pharmacy. There are a lot of foods, a lot of fruits, medication interact with each other. It all depends on what medication you've been prescribed, or if you are on a different medication and they prescribe something else, we have to look at the whole thing. It's just not that we can say, oh, this fruit or this food interacts with everything. It all depends on the medication that you've been prescribed. Yes. Prescription medication prices, the difference from pharmacy to pharmacy, no. And I'll give you a little bit more detailed answer on that. First off, the prices for medication, prescribed medication, is set by the government of the province. So let's say a government of Alberta sets the price for the medication, and everybody has to follow that. Same as for government of Saskatchewan. For us in Lloyd, it is different because the formulary prices for Alberta is different from Saskatchewan. So if we are filling a prescription for Saskatchewan patient, we have to change the price to that in order for the government to pay for it. The other aspect, I think this question been raised by so many people, is the dispensing fee. So dispensing fee is a fee that the College of Pharmacists will set for filling a prescription in a pharmacy. And they set a certain value for it. You cannot exceed that, but if you decide to go lower than that, you can, as long as you write you have it in writing to the college and also all the insurances. So certain pharmacies, they have less dispensing fee, and that's why the people think they're cheaper. No, the price of the drug is the same, it's just dispensing it might be different. It's a very common question. Can I drink? Oh, it's especially if they start their antibiotics on a Friday, they ask this question. Generally speaking, it all depends. We don't want alcohol with your medication because it might give you some extra side effects or stuff like that. But again, it all based on the medication history, what other drugs they are on, or what kind of indication it was prescribed for. Personally, in my humble opinion, if if you don't binge drink, or just maybe one or two just small like light drinks should be fine. As long as you remember to bring the pharmacy share the next day, then we're good. We can sign off on that. Storage of medication is a very good question. If you go and look at all the movies or whatever, everybody had that medicine cabinet in their washrooms or in their kitchen. That's the worst place to keep your medication, and the reason is you have more humidity and temperature change in those areas of the house. So where you want to keep your medication, if they are not required to be kept in a fridge or a certain condition, also, so technically if they have to be in a room temperature, I think the bedroom or somewhere in your living room that is out of the reach of the children would be the best place that has the less humidity in that area. Generic versus brand, to answer your question, short and concise, yes. Because for the generic drugs, in order to be approved by Health Canada to be marketed and sold, they have to meet certain standards. However, some people say, oh, I cannot tolerate the generic and I have side effects to that. And some people say, oh, I tried the brand and I can't try it. So it's just the effects of our body on a medication. That's what we call it, pharmacodynamics. That is something that we don't know until they try it. But as a pharmacist, they all the same. Your first aid kit, so some probably bandages, gauzes, wound stuff, some painkillers, Tylenol, Advil, some stomach for constipation, diarrhea, stuff like that you want to have at home because you never know. Some people may have, based on their medical conditions, they need some extra medication or even devices. So if you have a person with high blood pressure, so you want to have a blood pressure machine, a diabetic patient needs a blood sugar machine at home, or a person that might have a very severe allergic reaction, you might even want to have an EpiPen on hand. In terms of the growth in your career, I think pharmacists have a lot of options. So you can normally, the first thing that comes to everybody's mind is the pharmacist who's standing behind the counter answering the question, filling a prescription. That's the most common one. You can become a hospital pharmacist and practice in a hospital pharmacy, or you can go for some residency programs and actually work as a hospital pharmacist inside the wards, like cardiology, neurology, different departments. You can work in industry, in terms of manufacturing, on the manufacturing plants. You can work in government, for government in terms of policies. There are a lot of options available. Pharmacist income, it all depends again on what type of job you have and where you practice. So if you look at the pharmacist who is working as a staff pharmacist for somebody in like in a franchise or in like a big store, mostly they are hourly and based on, again, it depends. If you are practicing, for instance, downtown Vancouver, probably your wages would be lower to a person that works in a rural area. So you have to take that into consideration. But I think something about $45 an hour going up to could get anywhere, but I think the start around that area. If we want to answer this question is, I think we have to look at different metrics. One is the business side of it, as I mentioned earlier, as either are you either you are an owner, so you're a pharmacist who owns the pharmacy or the store, or the person who works for that pharmacist as a pharmacist. So the competition is growing, the cost of the business is going up, and you still have bills to pay, you still have staff to pay, and so it has become tougher and tougher and tougher. Like any other industry, they have to become much smarter. So the jobs are getting harder and harder. So you have to work harder for the same thing that maybe 10 years ago 3 people were doing. Now 1 person has to do the job for only 1, and it's just like any other industry. It's just pharmacy is not different. So that is tough in order for you to keep up and be able to open your doors. In terms of the practice, it doesn't infuriate, but if you want to stay where you be 5 years ago, a year ago, you cannot keep up with the profession, because the pharmacy evolving every day, the guidelines changing every day, and you have to study, you have to read. It's like a person who's in a school to be able to be on up to date with all the knowledge in terms of every disease, every medication that's changing on a daily basis. I love this profession. I think if I was born again, I would become a pharmacist if I could, because it is an integral role in a healthcare profession. And this is something that maybe a lot of people don't even see it, but we are the one that is really available to the patients. We are the one that working like multitasking every second. Physicians, nurse practitioners, dentists, veterinarians, patients, they all come back to us for questions because everybody is expert in one area, but the pharmacist has to have a knowledge about almost everything, or have to have access to all of it, so I can answer all those questions and build that connection between the patient, therapy, and the physicians, everybody, so the patients get the best therapy for themselves. I don't think I'm in a place to give advice to anyone, but it's always that have to be thirsty to learn, and that will drive you, and you have to be thirsty to help and educate your patients about their medication, about their lifestyle, about the decision they make about their lifestyle. And that will drive your practice, that will drive your business, that will make you a successful and well-known person in your community.